I'm gonna do a PowerPoint with you guys because I like to go over the content and I like for you guys to see something while I'm talking so that it's not as hard as to just understand when I'm talking. So I cover main concepts in exam in this review, 50 questions again. 5 will be math. So make sure you get your math under wraps, okay? I'll have you guys participate as much as you want, and you don't have to if you don't want to, because this is mostly my class and you guys are kind of quiet, but contribute as much as you want. I'll ask questions. I'm going to share the PowerPoint screens with you. In order to get the PowerPoint, you guys just watch the thingy on YouTube that I'll post, because we're not allowed to share unless we copyright them or something like that. I don't know. So all right, let's take a look right now, though, at our PowerPoint. We're going to start with, sorry.
No, I
We're
have
gonna
a
start,
class at 8, so I'm gonna leave a little bit early, just
that's
FYI.
okay. That's okay.
Okay.
As long as you're here, that's good. I'm glad that you joined on as much as you can. All right, we look really quickly. And like I said, guys, this will be about a 20-minute. I don't do a long review. I get to the point and we move on. Okay. So rural health, our children are our highest risk group in our rural health. We know rural health people, they're more prone to chronic diseases, decreased compliancy with safety, no leisure time, and they don't report health issues. Remember, we talked a little bit about this. What health issues do they not report usually?
Sexual infections, rape, stuff like that.
STDs, what else?
Domestic violence.
Say that again.
Domestic violence.
Yeah, domestic violence, very good. Any of your abuses, you're not going to see reported. And they're not going to really take good compliancy with healthcare because they're far out. They're not near a hospital. Hospital is really far away. We have in this rural community, we have our migrant farm workers. Remember, I bring this up again, musculoskeletal system with our migrant workers, right? They do that repetitive movement, that constantly straining their musculoskeletal system. Let's see here. Greatest risk, we talked about this in our case study tonight, our pesticide exposure. Remember, they come above, they like spray all this stuff. So what are some things we'll do for primary prevention for pesticides? What do we know primary is always going to be what?
Education and preventing.
Good. Educating, we're going to try to reduce their exposures, right? Then if you're going to do secondary, which we're doing what? If we're secondary, then what are we doing?
Screening.
How are you going to screen for pesticides?
Urine.
Yep, and blood. Right? You're going to check their blood. And then once we get to tertiary, we're going to do those treating things, right? We're going to look at that nausea, that vomiting, the skin irritation. We're going to really take care of those people. Okay? So be real careful with primary education, that you're educating before they get exposed, right? Because once they're exposed, then we go to secondary. Okay, our Mexican immigrants. I want you to know specifically about them culturally. They see the nurse as the authoritative figure. The nurse knows a lot. Respectful approach with them. You're going to respect their culture. You have a little chit chat with them before they start. And in their position, they feel like touching is caring. They don't find that that's offensive. Some cultures, you'll see eye contact they won't like. Right? But with our Mexican immigrants, they really like to get to know the nurse. Okay? So you may see a question. What's a question you think you might see on this?
I know with like Asian or Korean, they don't like eye contact or they find it disrespectful. So it might be a question like um a Mexican American comes in and is, I don't know, something relating to the eye contact and not the touching and conversational and whatnot.
Yeah. So it might be something like you have a patient that comes into the clinic. What are some things that you should try to do as the nurse? You're gonna touching shows caring, so you can either touch them or you're gonna establish a little chit chat, like have a conversation about what's going on in the world. right?
Or like not
That's-
to take offense if there's no eye contact from
Yeah, and
certain group.
Mexican immigrants, usually the eye contact's not a worry. So don't worry about that one, on that one. Our vulnerable populations, we look at those, we talked about those, that's a whole chapter. HIV is transmitted, we know, through sexual contact and body and blood fluids. Categories, clients who fall into the high-risk category are gonna be those who have done the following: used IV drugs, persistent and recurrent STDs, and individuals who have multiple sex partners, right? We know that. So what kind of a question we might see here is a client who is in a high risk category, include, select all that apply. Right? IV drug use, persistent and recurrent STDs, and multiple sex partners. You guys kind of know this about it. This was with our vulnerable populations, though. Why is it important to a community health nurse? What do we have to do as community health nurses with our vulnerable populations?
Gather
Sometimes we kind of,
information.
Somebody say that again?
Gather information.
Yeah, but we're not just gathering information. We always do that as a nurse. What are we doing specifically to the vulnerable population? We talked about this last week. What are some things we're going to be really sensitive to? Remember, we're going to not be judgmental, right?
oh,
Those
yeah.
kind of things. We got to be really careful, put them on their level, speak on their level, right? Knowing what they do. We know with poverty, homelessness, and teen pregnancy, our highest rate of homelessness with our teen pregnancies are those that are pregnant, because once they're pregnant, then they're on the streets. We look at alcohol, tobacco, and other drug use in the communities. When we look at our homeless, we think about those challenges they have. They don't have money, they don't have insurance, they don't have transportation. The healthcare is going to be crisis driven, meaning where is that happening? Where are they getting their healthcare?
The ER.
Good, the ER. And our family with children is our fastest growing homeless population. Unfortunately, very sad, but true. All right, high rates of STDs in our homeless pregnant population. Higher rates of addiction. We're going to have the poor nutrition. We're going to have poor health outcomes, right? Homelessness, dangerous ramifications for the mom and the baby. We know this. What are we going to try to do for a pregnant mom? What are we going to try to make sure she gets back into, even if she's not homeless? What correlates with success? There's 5 social determinants of health. One of them is really important with our pregnant teens.
School.
Good. We know that relationship between education and lower rates of poverty, right? We know that. All right, so nurse-family partnership, it takes a village. These babies who are having babies need our help, okay? So we're going to really help out as much as we can. So we talk about there's an increase in single motherhood, especially among our teens. We're going to educate them to stay in school, do everything we can, okay? We're going to help them with their self-care, with their nutrition, their lack of prenatal care, and limited finances. There's a lot of organizations that will help with pregnancy, right? That we know about. So we're going to really promote that with our pregnant teens. Addiction. There's sort of that high relapse if a drug is removed. So we know there's a physical and psychological dependency. What are some high risk factors for drug use?
Homelessness.
What else?
Mental illness.
Yeah.
That's all I was about to ask. Is that where we're going?
Yeah, we're going. There's lots of things. Keep going. Remember-
Is that and the homelessness and nutrition, mental illness.
Immunity.
Are we just talking about in general pregnant people too?
Just in general.
Their immunity.
What do you mean?
They're more susceptible to infections and diseases because they have abnormal substances in their body.
Okay, they could be. Remember, those people that are using drugs a lot of times, there's gonna be a genetic component, right? They're gonna be around them, other people that abuse drugs, right?
Mhm.
Because their friends are doing it, they're doing it. Also think about those that have been abused. There's a direct correlation between abuse and drug use. Doesn't mean everyone who's abused uses drugs, but there is that relationship. Okay, so those are kind of things. Very good. You guys got most of them. Any questions about drugs and addiction? All right, with our parish nurse, we know which one is going to be more autonomous. They have congregational, and then they have institutional. Which do you think is going to be more autonomous?
Congregational.
Good, Cindy. Why?
They can get out into people's homes rather than just stay at one place, like an institution would be.
Okay, so institutional, remember, is not necessarily in an institution. Institutional based parish nursing means that they work with many organizations to help out. Parish nursing, when they're faith-based or congregational based, remember, it's that nurse. There's only one nurse in the congregation. So she's taking care of everything. Once you get to institutional, then they're involving the whole community, meaning not the church community, but doctors and community centers and other stuff, right? So it gets bigger and bigger and bigger. So you're more autonomous when you have that one mosque or synagogue and you're going to be congregational based, okay? Chapter 29 is where we see parish nursing. We're going to look a little bit at ADPI, right? We know we're steering our conversations toward goals so that we can get outcomes with our patients. We're going to discuss health problems and limitations, right? As part of our assessment phase. Then we are able to come up with a diagnosis. And the planning occur after outcomes have been identified means so that we can change that plan so the outcomes can be met. Okay, so you can identify outcomes up front, but then you can change them depending on what you need to do. A big one was Medicaid versus Medicare will be on your test. Medicare is going to be our 65 and older. You remember it's federal. We need skilled services to be reimbursed in our Medicare. Not babysitting, and they must be homebound. So they got to be homebound and get nursing services in order to get reimbursed. Medicaid is going to be aid to the people, going to be based on lack of financial resources, administered by the state and federally funded. So Medicaid is both, where Medicaid is federal. Doesn't necessarily require the homebound, and Medicaid sometimes will reimburse for activities of daily living, like changing, like bathing, like all that kind of stuff. Okay, those are big differences between the two. Hospice care was a chapter that we covered, and remember, it's our end-of-life care. Our goal here is to end life with dignity and comfort. We're going to try to alleviate pain, encourage family and friends to communicate, and curing disease is definitely not the goal here, right? All right, here we go on to tonight's work, which was epidemiological triangle. We know that it has the 3 parts. Page 155, box 9-1 is a good example of this. We know our agent is our virus or bacterium, a parasite, or our microbes. Host is who's getting it and who's going to have it. And then our environment are those factors that can make it more exposed and susceptible. So it really brings that host and that agent together. So just remember, our disease is going to be produced by exposure to a host with an agent in the presence of environmental factors. A question you may see on a test might be, 5 people in an office building are all sick with COVID. What are the 5 people? What parts of the triangle are the 5 people?
The host.
Good. Those are the people who are getting whatever. What would the agent be in that one?
The
The-
virus.
Yeah, the COVID, and the environment would be
The office building.
very good, the office building. And what's going on in that office building, right? Maybe poor ventilation, maybe cubes where they're not separated, something like that. Here's another example that I like to use, host environment agent. Just know that it's a circle. It's a triangle, but they all connect as a circle, okay? So our hosts are going to be examples like age, sex, race, religion, customs, occupation, genetic profile, family background, immune status, right? Our agent's going to be those things like our bacteria, our viruses, our poisons, our alcohol, our smoke, our radiation. The environment, what's going to help it grow, and what I want you to think about is when you're thinking about this, think about like mold, where you see molds grow. Where do you see it grow? Where do
In
you see mold
areas
grow?
that have moisture.
Yeah. Do you ever have moisture? Or you'll see molds grow on cheese. Why does molds grow on cheese? Anybody know? They actually have a fungus in some of the cheeses. So it just looks like mold, but it's really a fungus coming out. So I want you to think about these things when you think about the environment. So temperature, humidity, altitude. What happens the higher you get up in Denver, Colorado? It's harder to breathe. Why is that? Because we're a foot higher, 52, 80 feet above sea level. So think about that. Okay. Environmental health, we talked about this in one of our case studies. We look at air quality, water, sanitation. We use 3 R's when we're dealing with environmental health. Reduce, reuse, and recycle. Okay, that's what we can do as a community-based nurse to help out our environment. All right, we have a couple terms that I do need you guys to know about epidemiology. Remember, that's a study of why do things happen and who does it happen to. So we have our case fatality rate, which is going to be like our what chance do I have to survive? Like how many people die from this? So when somebody gets diagnosed, they'll be like, what's my chances, right? And then case mortality, a case specific morbidity rate, and then our accrued mortality rate, our rate at which deaths occur for a certain cause. So these are 4, if you look at page 154, chapter 9, these are 4 definitional words that I need you guys to know. You will see them on your test. So again, it's going to be attack rate, case fatality rate, case specific, and accrued mortality rate. Okay. We look at study design. This is a little bit more with our epidemiology. Why are we doing it? So sometimes we do a case control where you have somebody has the disease and then you have a control where they don't have anything. We have cross-sectional, which can go all the way around and see where is it most prevalent? Why is it most prevalent? Then we have retrospective where we look back at all our data and we see it's in retro, it's behind the time. So we look at these old cases and see why has this happened and what caused it. All right, so we have several different study designs that we'll look at. Any questions on this? You're going to have to really know the different examples. So ecological, case control, cross-sectional, and retrospective. The way I always remind you to remember retrospective is think of the word retro. It means back in time. Okay, so you're going to look at those things that have already happened. All right, occupational health nurse, we know that we talked about this in one of our case studies tonight. We know it's very autonomous. If you think about your occupational health nurses that are in the hospital, if you go into the employee health, usually there's only one nurse in there and then there's like a secretary or something, right? So think they are about the health and safety of all employees. So for primary prevention, we're going to make sure we're wearing proper equipment. We're educating. Secondary, we're going to be screening for any diseases that pop up at work. And tertiary is when you have like workers' comp. You've gotten hurt and you need some rehab from being hurt at work. OSHA, remember, is our Occupational Safety and Health Act of 1970. It will give us safe and healthy working conditions for men and women. Occupational health nurses help with OSHA, making sure OSHA standards are followed. We have a couple different agencies in healthcare that we focus on. We have our World Health Organization. And the World Health Organization does a lot. What do they look at? They look at our drug reactions. They set our standards for vaccines all over the world. Share research. They provide information. They collaborate with other counties. Agency for Healthcare Research and Quality is really quality and safety. That's not going to be a federal one, a worldwide one. That's just going to be monitoring healthcare research and quality. We have our Center for Disease Control and Prevention, right, which is going to monitor health. We look at problems and prevention. And we have HRSA, which is our Health Resources and Services Administration, and they do education and funding for our healthcare professionals. All right, we looked a little bit about ethics last week. So remember, our malpractice is our act or failure to act that leads to injury. You had a question on your quiz about that, an example of malpractice. Consider these scenarios as a future nurse. What are you going to come in contact with? In order to prove negligence, the nurse must be responsible for the client's care. They had a duty to act as a reasonable nurse. They failed to act, so they led to injury. And they look for monetary compensation with this. This is where you'll have professional negligence. All right. So that about covers the main topics that I want you guys to know for the test. I'm just going through them again. Any questions on what we've covered? Nothing? You guys are always quiet, so I'm not surprised.
Can I have a question real quick? Can
Go ahead.
somebody get sued for malpractice and negligence? 'Cause they have common-
Usually it's malpractice or negligence, but I'm sure there's been cases where you can get both.
Yeah, because
'cause
they
if
have
you're-
one common thing and one common point in common. They both had failure to act.
Yeah. And a
Okay.
lot of our ethics, are a failure to act. We don't do something that's going to hurt somebody. Also, we always have that problem too with where we do something that hurts them, right? But that's like our, our Hippocratic oath. We don't take one as nurses because we're not doctors. We sure should follow the same standards. And we do follow that with the Nurse Practice Act, right? An American Nursing Association and our registered nurse license. All right, so hopefully that helped. It should have paralleled the study guide quite a bit. Because a lot that's on the study guide will be on the test as well. Okay, if anybody needs to meet with me or would like to meet with me, I'm always available privately to go over content with you. Just send me an email or send me a text and I'll get together with you guys before the test. Otherwise, please make sure to attend as many exam reviews as you can. Okay? All right, good night, everyone. Take care.
Thank you.
You're welcome.